Hello everyone. In this video, I'm going to talk about Olanzapine. Olanzapine is well known by its brand name, Zyprexa. This medication is classified as an atypical antipsychotic. It is a second-generation antipsychotic. However, it can also be used to treat other conditions like bipolar disorder. It is also considered an anti-manic agent. Before taking Olanzapine, you need blood tests to assess the baseline blood counts. In a few situations, your body temperature may be raised with the use of this medication. Development of infections may limit use of Olanzapine. In this video, we are going to discuss such essential things that are required to know before the use of Olanzapine, like how this medication works, how to take this medication, and what the important precautions and side effects are. First, let's see how it works. Olanzapine can work on your brain to reduce the symptoms of schizophrenia. People with schizophrenia may have symptoms like hallucinations and delusions, which are often termed as positive symptoms. Few of the other symptoms are like a lack of motivation, withdrawal from social life, and lack of emotions are classified as negative symptoms. Olanzapine can relieve both positive as well as negative symptoms of schizophrenia by acting through different types of receptors. It blocks the action of dopamine as well as serotonin in the brain. It can block the dopamine D2 receptors in the mesolimbic pathway, which results in the relief of positive symptoms. It can also block the serotonin 5-HT2A receptors in the frontal cortex that helps in relieving negative symptoms. Apart from these actions, Olanzapine can also block other receptors like histamine H1 receptors, which may result in the induction of sedation. It can also block alpha-1 adrenergic receptors, leading to hypotension. It also blocks muscarinic receptors, leading to anticholinergic side effects like dry mouth and constipation. However, the action on psychotic symptoms is mainly related to its action on dopamine as well as serotonin. How to take this medication? It is available as a normal tablet as well as an orally disintegrating tablet. For the treatment of schizophrenia, it can be started at 5 to 10 milligrams per day initially. The dose may be increased after 1 week of treatment based on the clinical response, and the target dose may be 10 to 20 milligrams per day. Never take Olanzapine above 20 milligrams per day. This medication is extensively metabolized in the liver. It can be taken with or without food. While you're handling oral disintegration tablets, don't push the tablet through the foil. You should handle it with dry hands. For the treatment of bipolar mania, it can be given at an initial dose of 10 to 15 milligrams per day. It can also be used to control the agitation associated with schizophrenia or bipolar mania, where it is given by the intramuscular route. For the treatment of bipolar depression, it can be combined with a few of the antidepressants like fluoxetine. Here it is given as a 5 milligrams in the evening. Side effects. You may have orthostatic hypotension, sleepiness, dizziness, insomnia, and weakness. It can also produce dry mouth, constipation, indigestion, and weight gain. Now let's focus on precautions that are to be taken while using this medication. When you're having strenuous exercise, dehydration, or using other anticholinergic drugs, your body temperature may be elevated, leading to loss of thermal regulation. Therefore, in such conditions, you should use this medication carefully. Olanzapine can cause a condition called blood dyscrasias that results in a reduction of your blood counts. It can induce neutropenia, a reduction in neutrophil count that may increase the risk of infections. Leukopenia and agranulocytosis can also be observed. You may have weakness, fatigue, increased bleeding, and risk of infections. Therefore, when you observe these symptoms, or when your absolute neutrophil count is less than 1,000 per cubic millimeter, you should discontinue this medication. It can produce irreversible involuntary movements. They are more pronounced in the elder woman. If they're troublesome, you should discontinue use of Olanzapine. You may have a condition called tardive dyskinesia, which is a slowly developing movement disorder. In a few people, this condition may reappear even after discontinuation of the treatment. Sometimes using the Olanzapine can mask the symptoms of developing tardive dyskinesia. So when you discontinue this medication, the symptoms of tardive dyskinesia may reappear. Olanzapine is not suitable for treating dementia-related psychosis. In the elders, this medication can increase a few cerebrovascular effects. It may increase the risk of stroke or ischemic attack. Therefore, in the elders, if psychosis is associated with dementia, this medication is not preferred to relieve psychotic symptoms, as it may further complicate the condition. This medication can lower the seizure threshold, So if you have any previous history of seizures, the risk of seizures may be increased. Prolactin levels may be elevated with the use of olanzapine. This is due to its blocking action on dopamine receptors. Normally, dopamine controls prolactin levels. However, olanzapine blocks the actions of dopamine, leading to elevated levels of prolactin. It may result in breast tenderness and enlargement. However, this effect is relatively less severe compared with first-generation antipsychotics. Use with care if you have impaired attention. Olanzapine may cause sleepiness, and it can also reduce blood pressure when you change your posture. This may increase the risk of falls and fractures or injuries. This medication may increase your weight, and it can also produce hyperlipidemia, increasing lipid levels. So fasting lipid tests may be done before starting the therapy. It can also increase the glucose levels. Therefore, if you are diabetic, use this medication with caution. Olanzapine can produce suicidal attempts in people with schizophrenia or bipolar disorder. The risk may be more pronounced when you use this medication in combination with other medications like fluoxetine. These are the essential things that you should know before taking olanzapine. That's all about this week's story. Thanks for watching this video. If you find any interesting facts on this medication, please share them in the comment box below. Please do subscribe and hit the like button. I will come with another interesting video in the next week. Until then, have a nice time, take care, and goodbye.